the April 2023 release of the PIPR, or Pre-Implementation Performance Reports. The value-based purchasing expansion that went nationwide January 1st of 2023 and impacts all Medicare certified agencies has its own website, or web page, I should say, on the CMS website, and they are specifically associated with CMMI. The value-based purchasing webpage has access for you to register to receive the newsletters that are done monthly for the value-based purchasing expansion specifically. And there was an April newsletter that was just released that is covering some of the data we're going to discuss today, including the changes to the risk adjustment factors and some changes related to the home health quality reporting program. The PIPR, or Pre-Implementation Performance Reports, have had 3 versions, the most recent released the 3rd week of April, and can be found in the iKey system where you typically extract your CASPR reports. The PIPR reports show your current percentile ranking by individual outcome measure as compared to agencies across the nation that will be a part of your cohort in the live value-based purchasing expansion calculations for 2023. These PIPR reports are based on prior year activity and your data through parts of 2022. The real implementation reports, or the current implementation reports for 2023, will begin being released in July of 2023 and will include the current achievements, thresholds, and benchmarks from the baseline year 2022, which will be used in the calculation of the 2023 outcomes. It's extremely important that you review these PIPR reports to understand exactly where your organization stands in comparison to other agencies in specific outcome measures in the current year as we progress through this expansion to ensure that you're staying on top of it. If your items, your individual measures, are ranking in the 51st or greater percentile, you are likely to have a positive outcome in the reimbursement impact calculation that will take place when all 2023 data has been collected and calculated. In the web page specific to the expansion, there's a list of resources, and 2 of the items have changed, including 2 documents that specifically discuss risk adjustment. One of them specifically the risk adjustment factors that impact the calculation of the total normalized composite change scores in mobility and self-care. Also note that in the April newsletter, they do discuss the risk adjustment factor of removing patients from the calculation for dyspnea, oral meds, the 2 total normalized composite change measures, and discharge to community. Patients are being removed from those measure outcome calculations when the patient has been discharged to a non-institutional hospice. This is good news, and you want to make sure you understand how it will impact your outcome measures. I want to thank you all for participating today. If you have any additional questions about the content today or need any of the services HPS can provide for you, specifically related to value-based purchasing or otherwise, please don't hesitate to reach out. I hope you have a fabulous week, and I hope to see you at a live conference this summer.